So thank you, Robert, for provoking us panelists. And now each panelist is going to have about 5, 6, 7 minutes to talk about both their next 4 years as it relates to their organization, but also in that touch upon one of the issues that Robert has raised, whether it's nimbleness and philanthropy, the value proposition, public policy, diversity, the blurring of the sector, what that means, is that an opportunity, and then this social agenda, this idea of a reflection on the social agenda. So with that, we're going to start with Jerry.
We, as a foundation, Legacy Foundation, evolved as a healthcare provider, and that's really been our mission. We're about quality of life and health, as I think all of you know. Over the last 12 years, realizing that the task of dealing with access to healthcare, community health improvement, building that workforce is a task that is rather daunting in the sense that there really aren't enough resources to really do 100% of what you need to do. So what you have to figure out as a foundation is what difference can you make. And when I was in my hospital career, where I spent 30 years as a hospital CEO, I would go to the American Hospital Association meetings and listen on policy and how can hospitals influence healthcare. And there was one chart that just emblazoned on my brain that I cannot get out of my brain, and that is, what was the topic at the American Hospital Association in 1945? Cost of healthcare. What was it in 1950? Cost of healthcare. And it just goes on. What is it today? The cost of healthcare and the availability of care. What will happen to Obamacare and how it ends up becoming an implemented policy, program, a law in Arizona is yet to be seen. Volumes of paper. I just went through a half-inch pile of paper from the Arizona Association of Community Health Centers, looking at the various issues as they are faced. Talk about organizations that are being inundated today. Their volume of patients are overwhelming. So we, being a grassroots funder, realize the importance of looking at, just like AGF and working with the Alliance, need to be very conscious of who our partners are, who we're working with. So we've really gotten very heavily involved with the Association of Community Health Centers, continue with the Arizona Hospital Association, American Hospital Association. Obviously, Grantmakers has now a health affinity group that we believe is going to be very powerful, very important. Grantmakers in health. Hospital conversion foundations, as we are one of 3 in Arizona, St. Luke's Health Initiatives, and now Sun Health. There's about 190 or so conversion foundations across the country. So we have our own association. And they too are very much involved in looking at the whole health scene. So we really look to those organizations in the sense of policy and what can we do to glean from their direction. And I think a term that you use, Robert, being flexible. We've learned that we have to be flexible in what we do in our whole access to health care. And what we try to do is be a safety net. Look out. We were wondering.
That's kind of fishy to me.
And it kind of feels, this is kind of how we feel, honestly. We feel like, yeah, we did $55 million in the last 12 years. Like you say, so what? Yeah, we did a lot of good, but one fish at a time. And you look out over Phoenix, and that's a huge ocean of people. And the amount of people that need help through that safety net are voluminous. So how do you tackle that? And we have seen the work of other foundations in this room that we like a lot in respect of what we do as well, and that is look for organizations and try and create this massive safety net out there in helping to create, we helped create the UMOM Clinic, Neighborhood Christian Clinic, 2 dental suites, Mission of Mercy, Bob Withers and Rotary and Legacy and others are going to be setting up another clinic with Mission of Mercy in another location in South Phoenix through the Murphy School District area. We built the first ever YMCA health clinic in the YMCA Christown that services health, dental for kids in that region. We interact with Banner Health, John C. Lincoln, Scottsdale Hospital in their school-based clinics. We've done that for 30+ years as a hospital and now as a foundation. Again, just one fish at a time, but these are children. These are children that we're really relating to heavily. Obviously with UMOM, it's parents. With Neighborhood Christian, it's the homeless adults. We do a lot of work with Mountain Park and Clinica Adelante. We believe those are the players who are doing the heavy lifting, that we need to make sure their sustainability is strong through this whole maze of activity that they're just being inundated with. I mean, UMOM had their clinic a couple of years now, and they're overwhelmed. They're overloaded. They're looking now to figure out a way to buy another motel and then move out what they've got next to the clinic, and then we agreed we're going to help expand that clinic as well. So we found our niche there, especially. Again, it's through the interaction through these associations. Community health improvement, we believe that Mary and I are working now with organizations, and we just had meetings with Banner MD Anderson in the area of looking at cancer and prevention. And they want to launch a major prevention program. Prevention is an incredible piece of this whole legislation and Obamacare. We need to look at prevention in a much bigger way. So the next 4 years is going to be a heavy dollar amount for us with the prevention side. And we're going to work with them, especially in their efforts on the cancer side. There's other disease areas. We're working with YMCA and St. Vincent de Paul on the diabetes and obesity side in the prevention of that activity. That list can go on. Malnutrition, real pleased to hear the hunger collaborative is going to go again, because malnutrition is a huge issue and we're very supportive of that. So, but sustainability, if I could just leave you with that, sustainability, and encourage all of you to look for ways to sustain those nonprofits. And we kind of got off a little bit in our activities in the sense of how we do that. We discovered that we are also a working poor qualified organization with the governor, that 13% of the population uses working poor. Now there's an opportunity, that's why they haven't eliminated that tax credit, because hardly anybody uses it. We need to be using that. We need to encourage our nonprofit partners to use it. We worked recently with Family Promise. Bob's on the Family Promise board, and we brought in a consultant to help. They doubled their working poor contributions through a little bit of help, and they plan to triple it this year. And we're working with Raising Special Kids in the same way. So doing some of that work with nonprofits, how can we tap? Wouldn't it be nice to know that 2 years from now, 75% of the working poor tax credit is being utilized, and not just 13. A huge amount of money. Funding is limited. The source of funding is limited. And here's a little nugget, a little gold mine.
Thank you, Chair.
I'm talking too much.
Yeah, no, you're not.